South Shore's morning news continues. I know we do need that. It is very warm out in the hallway, but comfortable in studio. And I've got two guests in here, very comfortable as well on the morning news. And once a month, we do have our Croí Health segment, formerly NVNA and Hospice. Croí Health, proud to provide quality home care, hospice, and palliative services to 27 towns from Plymouth to Milton. Visit croihealth.org, CROI health.org. And as always, we have the CEO of Croí Health in studio once a month, Renee and McInnes. Renee, good morning to you.
Hey, Rob, how are you?
I'm doing great. How have you been? You had a good, having a good summer still?
Yeah, good so far. No complaints.
All right.
I love the heat, so all good.
Oh, then you probably love it in the WATD hallway.
Yeah.
A little bit of a swampy feel out there. All right. Well, anyway, summertime is good. Yeah, you got to enjoy the heat because the opposite, we remember, we don't want to think about what it was like last winter.
We will be complaining in February.
Hey, all right. Well, it's good to have you, Renee, in studio as always. And, of course,
Thanks
we're up on YouTube as well. And you'll see that Renee, again, has brought a great expert guest with her as usual. Renee, right?
Yes, I have. So Dr. Nick Csikesz, who was with me on another segment, back today. I'll let Nick introduce himself and what he's doing for Croí Health, our hospice and palliative care medical director. And we're going to talk a little bit about Most and Pulse today. So, Nick, if you sort of want to give a little quick bio.
Sure. Thanks, Renee. Hi, Rob. Good to see you again.
Good to see you, Dr. Csikesz.
So as Renee said, I'm Nick Csikesz. I'm a pulmonary critical care doc by training. I spent a bunch of years in the ICU at South Shore Hospital and have been at Croí Health for a little over 6 months now as the medical director of hospice and palliative medicine. And I am excited to talk about that today.
Great. Right. Good. Want to talk more about palliative care and hospice. So everyone's always confused about what does it mean? What is palliative care? What is hospice? So maybe explain a little bit, Nick, about, at Croí Health, how we are caring for patients, palliative care patients or seriously ill patients in the home. Goal is to, offer them comfort measures that help them to stay home, symptoms, and not go to the hospital, but live their life. Have a quality of life, and not in and out of the emergency room. So maybe explain a little bit about what we're doing.
Yeah, so I think it's an important distinction, and I think there is a lot of confusion in the community, and then, I see it amongst healthcare professionals too, of kind of using the terms palliative and hospice interchangeably when they're really two distinct entities. So palliative care is a branch of care aimed at really focusing on the person as a whole in caring for someone with advanced illness, while they are often still pursuing curative treatment. So patients with advanced lung disease, advanced heart disease, advanced cancer, who are going under treatment with their cardiologist, their pulmonologist, their oncologist, and trying to get better, but suffering with a lot of symptoms. And that's where palliative care comes in, to really focus on those symptoms and on the person as a whole, and trying to help support them the best they can.
Right.
It's also a service that helps to engage in discussion about what options are if those treatments stop working or stop becoming an option. Hospice is a service aimed at supporting people who are at or near the end of their life. The insurance coverage for hospice is geared from Medicare for people who are felt in the view of their doctor to be in their last 6 months of life. And Medicare acknowledges that we don't have a crystal ball, and many times are wrong in that assessment. But that's the general focus of hospice, is on supporting people when they really are near the end of their life.
Right. And I think there is, I get phone calls, as does Nick and many other people at my organization, with people we know at the end, loved one is at the end of life. And someone I just spoke to the other day, and she said, well, I don't know. I mean, maybe they said a couple of weeks. So is that hospice? I'm like, oh, yes, it is. President Carter was on hospice for 2 years because, it was end of life, but no crystal ball, right?
We don't, yeah.
Right, so.
And I think that's important to acknowledge because, I think hospice has this stigma attached to it in this country, and many people think of it as a service for when you're in your last hours or days of life. And that's really, we certainly care for many people, who
Yes.
come onto hospice in their last hours or days, and we can provide some good support. But really the full benefit of the service is when we can engage with a patient and their family over a longer period of time and provide more support.
100%. And,
Yeah.
and people understand that once they do get the services, they say, wow, I wish I had had these services sooner. They never say, I wish I had had these services later, right?
No,
So-
we never say that, and that's why I know you wanted to make sure we highlight again about planning and having
Exactly.
these
Yes.
conversations because
Yes. Yeah.
it's so important. I mean, everybody would love to, always say, well, what would so and so want? And sometimes it's so sad when we don't know, and we're just trying to figure it out.
Yeah.
But imagine if you could get what anybody wanted, and you would want to know their wishes, right, and have it spelled out.
100%. And it's never something people really want to talk about, but it's so
No.
important. So, Nick, I would like to talk about a little bit about the MOLST and what that is. And now there's going to be the PULST and what that is. So people understand when they go see their primary care physician or they're in the hospital, whatever might happen with a health encounter, when someone says to them, do you have a MOLST? And now, do you have a PULST? What does that mean?
Yeah. I
So-
think it's important to explain
Yeah.
that. Yeah, because there's terms I'm not familiar with, and I don't know.
Yeah.
Right.
So real quick before that, first and foremost, get a healthcare proxy.
Right.
Fill
Okay.
out a healthcare proxy form. You need 2 witnesses that are not the person you're identifying as a proxy, because the MOLST and the PULST that's to come are geared at giving advice to your proxy about your decisions on specific choices. But
Oh, okay.
you can't predict what options you might be faced with, and so your proxy is the one who can be a living, breathing person to help act on your behalf.
Okay.
But the MOLST is the Massachusetts Maintenance of Life-Sustaining Treatment form. It's a pink piece of paper that many of you may have seen or heard about, where you're designating choices about things like, would you want CPR if your heart were to stop beating? Would you want to be kept alive on a ventilator if you couldn't breathe on your own? And it's a really important form to review and go over and fill out with your doctor, both to designate what your choices are, and again, to kind of serve as a guide for discussing with your healthcare proxy what your wishes may be. Massachusetts is joining a growing number of states in becoming a PULST state that is geared for April of 27, so less than a year away. And the PULST stands for the Physician Order of Life-Sustaining Treatment, and will take the place of the MOLST and be an electronic repository where EMTs, doctors' offices, hospitals will all have access, and it'll eliminate the confusion that we often run into where, oh, do they have a MOLST? I don't know. Oh, I think it's in that drawer. I can't find it.
Yeah.
And so this
Okay.
will be available easily for everyone to access. And so that's coming in less than a year. And that's something that at Croí Health will be pretty active in helping to make that transition. It will not make the MOLST invalid. People who have a filled out MOLST, it's fine. It'll
Yeah.
still be valid, but it'll be the path moving forward.
Okay, so this is something that helps standardize, but also makes it better. I mean, this is a good use of technology,
It's a
right?
good use of
100%.
technology.
Yeah, I mean, because we have it available to us, so why not use it? As opposed to, you said, you come in and you can't find something, it's missing. I mean, you always think about all these things are not happening at a very calm, peaceful moment. These are happening at stressful moments.
that's
And,
exactly
thinking,
right.
I don't know where it is. I don't know.
Yep.
Time is of the essence at this point. So,
Right, and you don't know where your loved one put it, and this
Yeah.
is great with the technology that anyone can access it at any time, because Nick working in the ICU, and I had worked
Yeah.
as a nurse in the ICU, there were many times we did not know
Yeah.
what the patient wanted. And that's really hard for the healthcare proxy.
well, I was going to say,
If
what
they don't know.
did you do, or what have people been doing? Right, it's very stressful. Like,
Well, it's very stressful.
You can't necessarily.
Do we
right?
continue life-sustaining treatment? Do
Yeah.
we continue the ventilator? When do you make those decisions? It's really hard.
And those are always going to be hard decisions for healthcare proxies. But
Yeah.
Right.
I think many times I have seen people have a lot more peace with the decisions when they can say, listen, we talked about this. I have this MOLST form that says what they wanted, and I'm going to respect those wishes.
So is this as a database? Is it something so no matter where I go, I can punch it up and it's there? Or
I think it's going to be mostly healthcare professionals that are accessing it.
Okay.
I don't think it's going to be like this is going to be essentially HIPAA protected information.
Well,
right?
yeah,
Where
yeah,
it's
that's what I meant,
It's your
but-
wishes. Like,
yeah.
I can't look up Rob Hakala's wishes just for fun.
Yeah, yeah.
but-
No, I understand. Yeah,
But so all health organizations are going to have access to it, and it'll be filling it out with your doctor, just like you do your MOLS now.
will those be shared with other states if you move, or could it?
They should be accessible in the states that are pulsed states. I think there are around 14 right now.
Okay, so this is still kind of coming together,
it's
and
still kinda
Massachusetts
coming
is going to
together.
get on board then,
Yeah.
it sounds like. Okay, wow. So 27, you said April 2020?
April of 2027.
Okay.
So about, 9 months away.
Not that far off.
Wow. Well, that's so that sounds like it is a step. You guys you would agree, obviously, because you guys see this all the
Yes.
time. This is a step in the right direction then.
Absolutely.
Very
Absolutely.
helpful. Okay.
100%.
All right, so MOLS to Pulsed and Dr. Nicholas Csikesz with us, Croí Health's Hospice and Palliative Medical Director, along with the CEO, Renee McInnes. And, of course, for more information and to reach out, Renee, people can always go to the website, right, and get connected, right?
Absolutely.
Go to Croí Health, and, again, that's CROI health.org, croihealth.org. Croí Health, and of course we do this once a month on WATD with Renee McInnes and of course special guests like Dr. Nicholas Csikesz. Renee and Doctor, thank you so much for coming on today.
Thank you.
Thanks for having us.
Thanks.